Hello everyone, welcome back to my channel. So those who haven't subscribed yet, please do subscribe so that you will get notifications and you can watch the videos on a continuous basis. Before you view this session, I would like you to view this the part 1 of the cerebellum so that there will be a continuity for the same. In this session, I am planning to discuss about the subdivisions of the cerebellum. The cerebellum is divided according to the anatomical architecture, according to the morphology and according to the function. So, first we will see how anatomically the cerebellum is classified or subdivided. So, we have already discussed in the previous session how the cerebellum is arranged in the posterior cranial fossa. So, in the beginning you have the anterior and posterior end. The first fissure to develop will be the posterolateral fissure. That is how it got the name, the posterolateral fissure, though in course of time it is actually getting folded and coming onto the anterior aspect. So when we discuss about the subdivisions of the cerebellum, we will actually open it up. So actually the cerebellum is located in the posterior cranial fossa in a folded manner like a closed book, but if you have to discuss about the subdivisions, we will just open it up and you will just keep it like this, and it will be easy for you to subdivide or discuss about the subdivisions of the cerebellum. So I've just taken a model so that it will be clear for you how you get a cerebellum like this as a sheet. When you see the cerebellum in gross anatomy, it is actually folded and it is actually a mass. Okay, so this is how you will get when you open it up. And the opening fissure is actually the horizontal fissure. So you actually open the cerebellum through the horizontal fissure. You go through the horizontal fissure and you just open it up so that you will get a cerebellum like this. Now let's see anatomically how the cerebellum is divided. Anatomically, the cerebellum is mainly divided into two parts. One, the corpus cerebelli, the major portion of the cerebellum, and the other one is the flocculonodular lobe. So, corpus cerebelli and the flocculonodular lobe are actually separated by the first formed fissure, that is the posterolateral fissure. So, this is the posterolateral fissure which divides. So, from this model you can see this is the flocculonodular lobe and the major portion is the corpus cerebelli, and the fissure which you get between these two, it is known as the posterolateral fissure. Now coming to the corpus cerebelli, it is further divided into anterior lobe and posterior lobe. Some even call it as the middle lobe. The posterior lobe is otherwise known as the middle lobe since it is actually lying between the anterior lobe and the flocculonodular lobe. This portion is also known as middle lobe. So what is the important fissure which divides the entire corpus cerebelli into anterior and posterior or middle lobe? That is actually the fissura prima, which was seen on the superior aspect and which cuts through the anterior 2/3 and posterior 1/3 of the superior vermis. So this is actually the fissura prima. That also you have to remember. Now the remaining portion between the fissura prima and the posterolateral fissure will give you the posterior or the middle lobe. Now let's see what are the components of the vermis as well as the cerebellar hemisphere which you get in each lobe when you discuss about the anatomical subdivision of cerebellum. That is very, very important. So in anatomical subdivision, the anterior lobe consists of vermis and its extension. So which are the parts of vermis? The first part is lingula, but it has got no lateral extension. So lingula, then CL stands for central lobule and C stands for culmen. And central lobule, the lateral extension is ala, and culmen, the lateral extension is quadrangular lobule. So all these lingula, central lobule and culmen of vermis and ala and quadrangular lobule of the cerebellar hemisphere all together forms the anterior lobe. One thing I would like to add for undergraduates, you need not mug up all the names as such, but it will be useful in case of entrance examinations, and postgraduates you have to remember all these things. So that is about the anterior lobe anatomically. What about the posterior or middle lobe? You have again the vermis extending from declive, folium, tuber, pyramid and uvula. These are the parts of the vermis coming in the posterior, or what you call it as middle lobe. And what are the extensions of the vermis laterally? You have the lobula simplex, and you have the semilunar lobule, superior and inferior semilunar lobule, the biventral lobule and the tonsil. These are the lateral extensions of the vermis which corresponds to the cerebellar hemisphere. So altogether you call it as posterior or middle lobe. Now coming to the floccular-nodular lobe, that is actually a nodule of vermis along with the peduncle which connects the flocculus with the nodule. So floccular portion is the lateral extension and the nodular portion is actually a part of vermis. So this altogether forms the flocculo-nodular lobule. So this is actually the anatomical subdivision of cerebellum. Now morphologically means according to the evolution and according to its specifications, this cerebellum is again divided into three types. Archicerebellum, which is a primitive one, then you have the paleocerebellum, then finally you have the neocerebellum. And this is again a transverse type of classification. Why I am stressing about this is, you have yet another classification known as functional classification, where you get the cerebellum divided longitudinally according to its function. We will come to it. So this is actually morphological classification based on evolution. So archicerebellum is actually seen in fish and amphibians, and it is otherwise known as vestibular cerebellum. Why? Because it is actually having connections to the vestibular nuclei. So which are the portions belonging to the archicerebellum? So the primitive cerebellum, that is actually the flocculo-nodular lobe. Okay, the flocculo-nodular lobe along with a portion of the vermis in the anterior lobe, that is the lingula. So lingula along with flocculo-nodular lobe, you call it as archicerebellum or vestibular cerebellum. When we think about vestibular connections, it is actually dealing with equilibrium, isn't it? So it is actually dealing with the tone, posture of the trunk, the main portion, the trunk, the equilibrium of the trunk. That you have to remember. It is the truncal equilibrium, the tone and posture. And now we will move on to the paleocerebellum. It is again getting evolved and it is seen in terrestrial vertebrates. It is otherwise known as spinal cerebellum. Why? Because it has got spinal connections. So which are the parts belonging to the paleocerebellum? So in the paleocerebellum, you have the anterior lobe, which we have already discussed in the anatomical classification, but except lingula, because lingula has already gone with the archicerebellum, isn't it? So it is the anterior lobe except lingula and also the pyramid and uvula of the posterior lobe. So anterior lobe except lingula and the pyramid and uvula of the posterior lobe, you will get the paleocerebellum or spinal cerebellum. And the function is, since it is seen in terrestrial vertebrates, it is concerned with movements of the limbs. So the tone, posture of the limbs are actually controlled by the paleocerebellum, whereas archicerebellum is actually governing the tone and posture of the trunk, and it is mainly dealing with equilibrium, hence called vestibular cerebellum. Now the most advanced or the recent, that is neocerebellum, and it is actually the largest portion of the cerebellum. It is also known as cerebral cerebellum. Why? Because it has got connections with the cortex, cerebral cortex. Hence it is through the cortico-pontocerebellar fibers, the recently evolved fibers, cortico-pontocerebellar, coming from the cortex through pons to the cerebellum. And what are the components of this neocerebellum? It is actually the main middle lobe, except the pyramid and uvula, because pyramid and uvula we have already mentioned it along with the paleocerebellum. So the entire middle lobe, or otherwise which is known as the posterior lobe, except the pyramid and uvula, it belongs to the neocerebellum. And we know since it is called cerebrocerebellum, it is having connections with the cerebral cortex through cortico-pontocerebellar fibers, and it is actually controlling the skilled voluntary movements of the muscle groups. That is the function of neocerebellum, and it is usually seen in primates, the highly evolved primates. So that's about the morphological classification, and we can see that it is again a transverse sort of classification. Then another classification of cerebellum, this is actually important for the postgraduates. For undergraduates, we expect these two classifications, mainly the anatomical as well as the morphological. But for postgraduates, you have to mention this as well, that is the functional classification, where you have the cerebellum arranged in the form of longitudinal zones. So how will you divide it? You have a median zone, you have an intermediate zone, and you have a lateral zone. And how this classification is, or on what basis you have this classification? It is based on the connections with the deep cerebellar nuclei. So in the coming sessions, I will discuss about the deep cerebellar nuclei, and then it will be easy for you to understand how these zones are connecting to each group of cerebellar nuclei. So please do keep watching. For the time being, you just remember, functionally, longitudinally, you have three main zones: the median zone, the intermediate zone, and lateral zone, based on its connection with the deep cerebellar nuclei. So if you get a short note to write about cerebellum, if you watch these two videos, this present video and the part 1, you can write a short note about the cerebellum, the external features, as well as the different subdivisions of cerebellum. In the coming sessions, we will be talking about the interior architecture, the connections, the functions, the cerebellar lesions, etc. So please do keep watching, please do share and subscribe, and please leave your valuable comments so that I will feel motivated to do more and more. Thank you.